Hello, everybody. The topic for the day is thyroid nodules and thyroid cancer. Now, thyroid nodule is an extremely common problem in the general population. For example, if we have a group of around 100 females, then more than 5 of them will be having a clinically apparent thyroid nodule. If we were to use ultrasound or during an autopsy, the prevalence would be even higher. But it's very important for everybody to know that majority of the thyroid nodules are benign in nature. That is, the risk of cancers is very, very low. However, it's very important to differentiate a benign nodule from a cancerous nodule so that we can guide the patient accordingly. So what is the reason why are these thyroid nodules formed? Well, there are a number of reasons for formation of thyroid nodules. For example, it can be due to growth of the normal thyroid tissue itself. Number one. Number two, sometimes because of inflammation in the thyroid gland. For example, as seen in Hashimoto's thyroiditis or other forms of thyroiditis, there is inflammation which results in formation of nodules in various parts of the thyroid gland. Iodine deficiency used to be the cause of goiter some time back. However, now because iodine replenishment is generally practiced all over India, that cause is now seen in lesser proportion of patients. Then sometimes it can be because of simple cysts that are fluid filled cavities in the thyroid gland. And finally, thyroid cancer, it's an uncommon cause of thyroid nodules relative to the others. Only 5% of the thyroid nodules are because of thyroid cancers per se. So, what to do when a patient comes in the clinic with a thyroid nodule? So, first of all, the physician will be taking a proper history from the patient. That is, when was it noticed? How rapidly it has grown? Is it causing any difficulty in swallowing? Is it causing any difficulty in breathing, especially when the patient is lying down? Then he'll be looking carefully at the nodule and examining it. Now, generally, the cancerous thyroid nodules, they grow very rapidly. Then they might cause features of obstruction like difficulty in breathing or difficulty in swallowing. Uh, Patients who have a family history of thyroid cancers, they are at an increased risk of developing the same problem. Patients who have had history of radiation in the past for any unrelated malignancies like for head and neck cancers, they may also be at a higher risk as compared to the other people in the population. Then the initial tests, which are generally recommended by the physician, would include a thyroid profile and an ultrasound of the thyroid gland. Now, an ultrasound, it's a very, very useful test for assessing the thyroid gland. It can tell us the various characteristics that would be pointing towards a malignancy. For example, presence of calcifications, irregular margins, and a solid cyst which is hypoechoic as compared to the rest of the gland. These are all pointing towards a higher risk of cancer. So, depending on all these features, the nodule is graded from a score of 1 onwards to determine the risk of cancer. As the score increases, so does the risk of a cancer. So, if the risk is high enough and the size is large enough, then the physician would be requesting for a needle aspiration of the nodule. Now, patients are usually very, very scared by the term needle aspiration. But this video is to assure everyone that it is an OPD procedure. There is no need for admission. Generally, the skin is numbed by the use of a local anesthetic topically, and then a needle is inserted to check for the presence of cancerous cells. So, depending on the findings, the nodule can be graded into a score depending on the findings of the needle aspiration. And then accordingly, the patient may be referred to a surgeon if the chances of malignancy are high, or if it's clean, then you just don't need to worry about it. So I hope by this video you learned about a thyroid nodule and the risk of thyroid cancer. If you have any questions, then please post them in the comment section below. Thank you.